This is a view of the liver from the anterior surface. This is how the liver looks from anterior part. This is a right lobe, this is a left lobe, and the two lobes of the liver are separated by a falciform ligament which is present anteriorly and superiorly. Then we can see the inferior border in this figure. This inferior border is notched at two sides, one at the fossa for the gallbladder, the area of the gallbladder, and there it forms a small notch which is called cystic notch, and another one at the ligamentum teres, that is called the notch for the ligamentum teres. This is the anterior surface. And while moving to the posterior aspect, this is the posterior surface. This area, this is the posterior surface of the liver, only this much. Okay, so in the posterior surface we can see the reflection of some ligaments. This is called the superior coronary ligament, this is the inferior coronary ligament, and these two ligaments together forms a right triangular ligament at the edge. So here you can see the right triangular ligament. Then on the left side, here there is a reflection of another peritoneal ligament which is called left triangular ligament. So this is left triangular, this is superior coronary, inferior coronary, and right triangular ligament. So on the posterior surface we can see another lobe which is called caudate lobe. The caudate lobe belongs to the posterior aspect. Then when we move to the inferior surface, in the inferior surface, this is the inferior surface having caudate lobe. So caudate lobe is present below the caudate, and caudate, we can see caudate lobe on the posterior surface but caudate on the inferior surface. In between the caudate and the caudate lobe, this is a caudate, this is a caudate. Between these two there is a gap, there is a space or fissure which is called porta hepatis. Porta hepatis is the hilum of the liver through which the hepatic artery enters inside, portal veins enter inside, then the hepatic vein that goes out through this porta hepatis. So while taking the boundary of caudate lobe and caudate lobe, while taking caudate lobe, we can see on the left side here is a ligament which is separating both right and left lobe of the liver on the posterior surface, and this ligament is called ligamentum venosum. And on the inferior aspect another ligament is present, this ligament is called ligamentum teres. So on the left side, this ligamentum venosum is present along the left side of the caudate lobe. So on the right side of the caudate you can see a groove like area, and this groove is for the inferior vena cava. The groove is formed by the impression or the location of the inferior vena cava. Then just below this you can see the area of the porta hepatis. So while taking the boundary of caudate lobe, you have to see superiorly it is continuous with the superior surface of the liver. Then on the right side there is groove for the inferior vena cava, and on the left side there is ligamentum venosum. Then inferiorly there is porta hepatis. Porta hepatis is the fissure that is present between caudate and caudate lobe. This is the boundary of the caudate lobe. Then comes to the caudate lobe. Caudate lobe, while keeping this liver in anatomical position, the caudate lobe has four boundaries. That is not superior inferior. Here we have to say anterior and posterior. So here comes its anterior border. Here comes the anterior border. Here is the posterior border, and here comes the left border, and here comes this right border. So the boundaries are anteriorly the inferior border of the liver, posteriorly the porta hepatis. So this is the location of the porta hepatis. Then on the left side our ligamentum teres. Then on the right side, the fossa for the gallbladder. So these are the boundaries of quadrate law.